Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Tylynn Ludwig, the owner of Tylynn Nutrition Therapy. Tylynn is a registered dietitian, certified eating disorder specialist, and sports nutrition pro with a passion for helping people heal their relationship with food. Tylynn works through an intuitive eating and health at every size lens, and she's all about busting nutrition myths, challenging diet culture, and bringing empowerment and joy to food. When Tylynn is not transforming lives through nutrition, she's currently training for the Ironman Women's World Championship in Kona, which will take place this October. And for those of you who are not familiar with what that is a very long-distance triathlon with swimming, biking, and running. Tylynn is a powerhouse of a woman, and we can't wait to share her deep nutritional knowledge with you. So turn up your volume and let's welcome her to the show.
Hey guys, welcome back to the podcast. We have Tylynn back with Tylynn Nutrition Therapy, and we had some awesome discussions in the past 2 episodes, just talking about, basic macronutrients, nutrition simplified. In the last one, we talked about intuitive eating and what that means. That was a really good conversation. In this one, we're going to be talking about one of Tylynn's specialties, which is eating disorders. And we're going to dive into that. Even if this doesn't necessarily apply to you at all, it might actually apply to somebody you know, or even start thinking about how we can help our kids through potentially dealing with this too. So Tylynn, the first question I guess I have is, what is your definition of an eating disorder? And, let's talk about the different types and dive into that.
Yeah, so there are many definitions of eating disorders, but I think for me, I would describe it as a complex mental health illness that is not a choice. Can affect people from diverse backgrounds. There's no single cause. And it's a complex combination of biological, psychological, and socio-cultural factors that converge and set off individuals' predisposed genetic vulnerabilities.
Yeah, that's quite a bit.
And when you're giving that definition, are you talking about kind of like a clinical eating disorder, like bulimia, anorexia, things that everybody has kind of heard of?
Correct. So there is something called the Diagnostic Statistic Manual, and this is what psychiatrists or mental health professionals use to diagnose clinical eating disorders. So there are certain criteria that people in the mental health profession have all collaborated on to determine these criteria. And when we are working with somebody and we see that they meet this criteria, they would be given a diagnosis of a clinical eating disorder depending on their symptoms. And I should say, as an eating disorder specialist and a dietitian, I cannot actually diagnose somebody with an eating disorder. It would actually have to come from a physician or a psychiatrist. But I have been doing this for quite a long time and working with hundreds, if not thousands of people at this point. And I can provide very high-level recommendation when I'm seeing somebody that they would probably meet criteria if I'm seeing that they're meeting criteria. But I can't actually get the diagnosis.
Right. I know before we kind of came online, you were talking about, the different areas of eating. So there's normal eating, and then there's disordered eating, and then there was something else. Can you kind of touch on all those different areas that you were talking about?
Yeah, so I think of eating disorders and disordered eating on sort of a spectrum because a lot of people think, well, I don't have an eating disorder, so I don't have a problem. And that's a little bit of a myth because if we have one end of the spectrum as normal eating and then the other end of the spectrum as a clinical diagnosed eating disorder, there is actually space in between. And that's actually where a lot of people fall. And that's what I call disordered eating. So maybe we don't meet quite to the criteria of a clinical eating disorder, but we may be skipping meals. We're thinking about food way more frequently than what we need to. We're trying to count calories and many other things that somebody might be doing where I would say that's a little disordered. And I think that still warrants attention. A lot of people think, well, because I don't meet a criteria for a clinical eating disorder doesn't mean I don't really need help for that. Or even as a parent, they might think, well, my son or daughter or my child doesn't need help for that. And that's a little bit of a myth because disordered habits often lead to clinical eating disorders. So if we can catch it early and we intervene when we're noticing disordered habits, that's really preventing these clinical eating disorders from setting in and becoming more ingrained in the brain.
Are most people leading into an eating disorder because of they want to look a certain way based off society's judgment, or is it because they want to be a certain pant size? What ultimately is, and everybody's different, but what are some really common reasons that people end up with an eating disorder?
Yeah, the reasons are really variable. And I want to go into the risk factors because I think this sheds light onto why eating disorders develop. So some risk factors, there are psychological and there are social risk factors. So I'll just start with the social risk factors first. Weight stigma is a big one. So people who are born in a larger body, they may be getting messages at the doctor from a very early age that they need to lose weight, even if they may have always been in a larger body, just genetically. They're just getting a lot of pressure. Maybe they're being bullied or teased at school. These people are much more likely to develop disordered eating habits and for them to go unrecognized because people think that they should be doing those things. So weight stigma is one. Internalizing the thin ideal, which I mentioned earlier in our other episode, which was that thin equals better, right? When we live in a culture where we say thin equals better, we learn that from a very early age. Young girls, as early as 5 years old, report fear of getting fat. When 5-year-olds are learning that and saying those things, we can recognize that this is happening to all of us in our society. So we have to teach our kids at an early age that thinness does not equate to health. Limited social networks can be a risk factor. So when we're more isolated, that can be a risk factor. Trauma is a big risk factor. So that can be physical, sexual, emotional, financial, any other form of trauma, but that's a big risk factor for eating disorders. And then there are certain psychological risk factors. So perfectionism is one, right? If you're just born to be more perfectionistic, that can lead or be a risk factor for an eating disorder. Cognitive inflexibility. So I mentioned like a spectrum. A lot of people have a hard time with that. They think right is right and wrong is wrong.
0 or 100.
Yeah.
I mean, you'll see that in everything, right? For sure.
So that can be a risk factor for an eating disorder because somebody thinks that's a bad food. I can never eat that. Right? And that is very inflexible. Impulsivity, that's a risk factor. Emotional dysregulation, body image dissatisfaction. Okay. And that is really frequently, I would say, or that's very frequent in our society. It's a risk factor. It doesn't mean that you have an eating disorder, but it's a risk factor for developing one. And then a personal history of mental health condition. If you have another mental health condition, it may place you at risk in a personal history of substance use disorder because of how the brain is impacted. And remember, I said eating disorders are brain-based illnesses. So some of these cross over into other different areas of the brain. And the reason I think it's so important that we catch eating disorders quickly and treat them quickly and get people better is because of the health consequences, the physical consequences. We know it's a mental health disorder, so it's impacting the brain, right? So I've worked with, 20-year-olds who have had untreated eating disorders since age 12, and psychologically they have not developed. So it may be like they are like working with somebody who's cognitively at the level of 12 because their brain never had a chance to fully develop. Okay. So there's a big impact on the brain. Cardiovascular system is impacted. So there can be electrolyte imbalances that lead to dizziness, chest pain, irregular heartbeat. If we think about dizziness, this is where people can pass out when they're standing up and then hit their head and have a head injury, which we pray that is not long-term or life-threatening, right? But that's why it's so important to treat. There could be signs of bradycardia, arrhythmias, low blood pressure, impacts the bone health. So nutrient deficiencies, if we're under eating, can lead to osteopenia, which is the weakening of bones, but also osteoporosis, which is actually like brittle bones, which we think of in like older adults, particularly older women, 70s, 80s, right? But no, I've had 20s, 30-year-olds.
20 or 30-year-olds?
Yes, even teens that have had such untreated eating disorders that they have osteoporosis at this early age, where they're walking around and they're getting treatment at a facility and they could actually break a bone just from, playing in the day room. Right?
I mean, I think that as teenagers and early 20s, you just don't think about the long-term effects of doing stuff like this. Like, you just want the results of whatever your mental goal is right then and there. But then you don't think about these long-term things. That's important.
No. Other things that I think about is endocrine and hormonal regulation. So this has a big impact on hormone production, potentially resulting in amenorrhea. For men, it's low testosterone or hypothyroidism if we're not eating enough or eating adequately. This also, for people who are involved in sports, places them at risk for developing sports-related injuries, stress fractures, those sorts of things, which we sometimes underestimate, like how much nutrition plays a role in that. And sometimes it's even unintentional for athletes. They just have such high demands that they don't realize that they're under eating.
Well, and then even fertility. You mentioned hormones, but if somebody has an eating disorder at a young age, and let's say that she is able to come out and recover from that, can that impact fertility?
Absolutely. But the nice thing about eating disorder recovery is that most of the complications that occur with eating disorders are completely reversible if you get treatment and you get help.
If you do
That's
it.
important.
Yep. The one thing that is not reversible is osteoporosis. We can help to maintain bone mass, but we can't necessarily reverse or gain bone mass, but there's like more treatments and research coming out all the time. So that's kind of a question mark at this point if that one's reversible, but you can improve your fertility if you get help and you get treatment for it.
Wow. I mean, this piece right here is just so important as to why. So if you know somebody and you're questioning if they might have an eating disorder or disordered eating, like we said, don't be afraid to talk to them. Like, their life and their future matters.
As to why these develop, 95% of eating disorders start from dieting.
So from some kind of restriction.
Yeah, I wanted to be healthier. That's how it always starts. And again, I've worked with hundreds, if not thousands of people at this point. I wanted to be healthier. My doctor says I needed to lose weight. And they went at it with no supervision or professional support. And they went to the extreme because they were perfectionistic. They're like, I'm going to do this and I'm going to do it well. And then it became out of hand. So this is really why I have such a hard stance against dieting, because this is what leads to the clinical eating disorders.
Yeah. You have definitely some perspective in what could be when you get too far.
So what are some indications that someone can apply? Let's talk about personally first, looking internally at our own habits and the disordered eating that probably a lot of us are experiencing, right? So what are some indications that maybe we're starting to go down a road that we need to be cautious of?
Yeah, so most of us know that eating is a social thing, right? If we're noticing that we ourselves are avoiding social situations that involve food, that's a sign. Using the bathroom frequently after meals can be a sign that potentially something's going on there. Compulsive exercising can be a sign. So if somebody's exercising at 9 or 10 o'clock at night and it's completely out of their usual schedule, avoiding food or certain foods. So oftentimes people are starting to restrict certain foods or food groups that they used to love. And then they say, I don't like that anymore. But really it's like, do you really not like cake? Do you really not like ice cream?
Yeah.
Right? It's very rare that people loved these things and then, went from doing a complete 180 in the course of a few months, which happens with a lot of my clients. Restrictive eating in any form can be a sign. Doesn't mean, again, there are certain medical criteria that we have to meet, but when we're cutting back on nutrition or skipping meals or snacks that we were eating before, that can be a sign.
If we have kids that are school-aged or teenagers, and we're seeing some flags, red flags, like you kind of mentioned, how do you start to approach them? You don't want to make them defensive. You want to make them feel safe. How can you help somebody that you love that you're concerned about having an eating disorder?
I would say with a really curious and empathetic approach. You do not want to go at them and say, stop doing that. Right? Because especially teenage population, they're going to do the exact opposite, right? It's just in that developmental population, like it's just inherently we want to rebel. And that's totally fine. That's natural for that age group. But pulling them aside and saying, hey, this is what I'm noticing and I'm really concerned about you, right? You're my daughter, you're my son, you're my kid. Like, I know that this isn't going to be healthy for you long-term. What can I do to help you?
Or like, what's going on? That's why I feel like being involved in your kid's life as much as you can and teaching from an early age too, just the benefits of healthy nutrition and stuff probably would be a really good, step. And also, I feel like with moms too, especially if we have daughters and sons, I have 2 boys, even talking about how I, see myself, or if my husband's talking about himself, I'm like, stop saying you're fat. They're hearing this. They will pull that in. Even boys will do this too. So how we talk about ourselves and how, we talk about other people or just how we judge others, they listen.
And I was just going to go there with saying, what can we do ourselves? Kids are sponges. If you think they're not listening, they are absolutely listening and they're absolutely observing. They notice. And I ask my kids this. I'm like, what was food like for you growing up in the house? Like, what did your parents say about their bodies? What was their relationship with food like? And when you don't have a good relationship with food, you cannot expect your child to have a good relationship with food. So that's often frustrating for me when I get somebody coming to me and saying like, I'm concerned about my kids eating. And then I find out, well, mom actually isn't taking care of herself either. And so it's a whole system, right? When I work with kids, it's a family system. I'm not just working with a kid. I'm working with the parents too, to understand and to help and support. And then for them to also work on themselves as well. So you get a whole package deal.
And I bet there's a lot of parents that probably are like, I really had something to do with this. There's probably a lot of education that goes with that. Yeah.
And really what I tell parents is that they are not the cause of an eating disorder. Maybe, you didn't have a good relationship with your body and you had chaotic eating, but there's also these other factors, right? There was a genetic predisposition. There was perfectionism. There were all these other things, maybe a little bit, but if they didn't have anything to do with the cause, they're going to be a really big factor in their kid getting better from an eating disorder, the number one factor, in fact. And that's why we work from a family-based systems approach, because when you have parents that are on board, your kid's going to get better. They're going to get past it. They're going to go on to live a healthy life. When we catch it early and we get the family involved, those are the best outcomes.
Definitely need that family support.
For sure. And you mentioned, being a good role model in this area for your kids is one thing to do. But for somebody who's listening and they have little kids, this is something where we want the best for them and we want them to live these healthy lives. But these are some eating disorders can happen in secret. And obviously maintaining open communication with your kids is an ultimate goal. Do you have any other tips on what parents can do to help protect their kids from eating disorders as they get older? Because their peers and society are going to put a lot of pressure on them. And is there anything else we can do to help set them up and put on almost like this armor as they grow up?
Yeah. Talk to them about body diversity, right? Keep stuff in your home that is not teen vogue. I'm sorry, I'm calling out teen vogue, but like I'm reflecting back to when I was a teenager, what the body sizes were, What are the advertisements in those magazines, right? We want media that is promoting all different body sizes, right? And talking to our kids about the fact that bodies come in all shapes and sizes. We're going to eat healthy and regularly and consistently. And, you don't have to do anything to change your shape. Kids are often comparing themselves to kids at school. And so if they come home making comments about their body, that's a good time to intervene too. And just, again, provide a little bit of education and support and saying like, it's totally fine to feel weird about your body at this stage.
Oh, yeah. Especially as they start in the preteen and teen years. Oh,
right?
My, yeah.
We all have such awkward pictures of that time of life.
We all remember that time too.
You got teeth that are all different sizes.
Your knobby knees.
And legs are like storks. At least that was for me. It's just funny.
Let's just normalize it. Like you don't have to do anything to change it. Like you're going through puberty, your hormones are changing. For women and for young girls, I'm going to give you some insight into why that is. So I mentioned puberty, right? When girls go through puberty, they have to gain a significant amount of weight in order to get a menstrual period. And that's because girls have to have a certain amount of estrogen in their body to support getting a menstrual period and to get it every month. We need more body fat than boys do. So girls are often gaining a little bit of weight before they get taller. So that means they're getting wider as they're about to get their menstrual period, or gaining some fat on our thighs, our buttocks, breast area, and then we get taller. For boys, it's the opposite. They actually gain muscle mass and height simultaneously at the same time. Okay. So boys, as they go through puberty, get closer to the quote unquote ideal of what boys are supposed to look like, even though to heck with the ideal, but still society says that. And girls are getting further away from it. And then they're comparing themselves on social media to other girls that, in California with the bikinis on the, or surfing or whatever it is, right? And they're thinking they're supposed to look like that. And that's not actually a reality.
Yeah, right.
Well, I think the ultimate question to finish out this episode is, if you identify somebody that you love, or even you're self-reflecting and you're seeing some red flags, what does the healing process actually look like? Where do you start? And what does this look like?
Yeah, I think the most feasible place to start is by talking to your primary care provider or your pediatrician and expressing concern, and just sharing and saying like, I need some more support in this. I'd say there's some really good primary care providers and pediatricians in Wisconsin, and I think they're really well equipped to refer out to if you feel like you need a program for more support. So programs have a variety of different settings. So it can be what we call an intensive outpatient program, where you may go and get support a few hours, a few days a week. Then there's a partial hospitalization program where it's more like 5 days a week of more intense day support. Then there's residential facilities where people live for a few weeks to months to help them get on track with their eating. If it's very severe, somebody may need to be hospitalized. So that's kind of the highest level of care, is inpatient. And then it kind of goes down from there. But then there's also outpatient, where that's what I do, where I work with people and they're still in their daily lives and trying to heal from their eating disorder. And the process is different for every single person. But what I will say is the process is not linear. And we don't just sign up for treatment and think it's going to be easy and smooth. There's a lot of bumps and hiccups, 2 steps forward, 1 step back. And the journey is different for every single person healing from an eating disorder. But again, it's not linear. For some people, it might be 6 months if it's caught early. Some people, it can be years that they're struggling with this. But what we know is that if you get treatment and you get help and you get support, this is so much more likely to be a better outcome versus I have parents who may have undertreated their child and then they're into adulthood and struggling because they didn't want to interrupt maybe school or other things. And when we know health is really the most important thing, because especially as the brain's developing in early adulthood and childhood, that's really when the brain's doing the most work and development. That's the best time to intervene, because we can learn new things.
That's a good point.
Absolutely.
That's a good point. Now, if somebody wants to reach out to you and work with you and ask you even just any more questions about this, because this is a topic that you have so much experience in, if somebody's listening and they have more questions, how can they contact you?
They can email me. They can reach out to me on Facebook or Instagram. But I would say email is usually the best option because I'm pretty responsive on my email.
You're a one-woman show, so yeah, you're the one seeing it.
24 hours is usually my turnaround time on emails. Unless it's a weekend, then I say 48 hours. But
Sure. Awesome. Well, thank you so much for sharing your knowledge in this area. I'm just so happy that we have an episode on it because it needs to be talked about. Right? We need to bring these challenges that are oftentimes secret up into the light so that we can help other people that we love. So thank you, Tylynn. And we do have one more episode coming up. We're going to be talking about athletes and how to use nutrition to fuel workouts and things like that. So that's going to be a really awesome episode that applies to a lot of people. We're not just going to be talking about if you're a high-level athlete, anybody who values fueling their body well, having a healthy style through workouts, things like that, this one's going to be for you. So that one's coming up next. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.